We had vast public investments in building the suburbs of America. Federally supported loans, FHA loans, went to people who were moving to the suburbs, and for many years, up until the 60s, those loans were available on a racially restricted basis. African Americans and other people of color didn't have access to them.
Until 1962, out of $120 billion in government-backed home loans, less than 2% went to non-white households. In Northern California, between the war and 1960, of 350,000 federally guaranteed new home loans, less than 100 went to black families. In cities like Richmond, African Americans were left behind in increasingly neglected neighborhoods. In the 1980s, poor Latino and Southeast Asian immigrants began joining them in these same neighborhoods.
Once the community starts to go downhill, nobody wants to actually invest in the community, so the banks don't want to come in and the shops don't want to come in. Then you don't have a commercial base, you don't have the community taxes that can then feed back into the schools. Now you don't have good schools, so families don't want to move into the community if they don't have to because you don't have good schools, and you get a sort of vicious cycle of everybody who can will leave the community.
This isn't something that happens overnight, and it isn't the fault of the people who live there. The people who live in low-income, disinvested communities did not do this to themselves.
20 years before his heart attack, Gwai tried to move his family out of Richmond, but 11 months later, they had to move back.
I can't find my job up there, and she can't find her job up there. And move back, my older son, hang around with the wrong group and then use some kind of drug. I just don't know what to do. I try to help him. I try to straighten him out. Spend a lot of money, owe people a lot of money. That's what in my mind all the time. So it's worry, just worry. When I'm going to pay up all of this, and how I'm going to do it.
If you think about when you're worried, you're always a little bit more activated. There's a little bit more vigilance. You're sort of checking things out a little bit more carefully. And if you can imagine that happening day after day, all day, every day, it's exhausting. And it wears on the body system.
When stress is chronic, when we're endlessly worried about our bills, our job, our children's safety, the body pumps out cortisol and adrenaline. But too much of these stress hormones over time can increase arterial plaque, raise blood pressure, and weaken our immune system, increasing our risk for almost every chronic disease, including heart disease, the leading killer in America.
We've done studies that have shown that living in disadvantaged neighborhoods is related to an increased risk. It's about 50 to 80% increase in risk of developing heart disease. And this has been replicated in other studies.